Well, overall, hospitalizations are down more than 1,000 since Indiana hit its all-time peak just 3 weeks ago. Case numbers are down here and across the country as well. According to the CDC, deaths in Indiana appear to be leveling out across the country as a whole. And still a lot of work to do, though. Let's bring in, welcome in, I should say, Wish TV's former Surgeon General and medical expert, General Dr. Jerome Adams. How you doing, Mr. Adams? How you doing today?
It's great to be here with you. I just finished shoveling the driveway, and so I couldn't be happier than to be inside and warm and to be having a conversation with you about some good news.
Yeah, we do have some good news. Let's start with the U.S. trends. So deaths are trending up in 35 states, but cases are down in 49 states. So can we say that the Omicron variant is losing its grip here, Dr. Adams?
Well, again, we've been here before, and so we don't want to. We want to be appropriately pleased that cases are coming down, but hospitalizations and deaths are still incredibly high, 2,000 a day. We want people to remember that the way to protect yourself now and against future variants is to get vaccinated and to get boosted, because we've already got this BA2 variant out there that is out competing the original Omicron variant in other countries.
You know, you tweeted that you see more ads for alcohol and tobacco than for vaccines. So what more should be done to promote vaccinations and boosters?
Well, one of the things I've heard is that the administration has made a big ad buy to target information about vaccines, positive information, in more places, more TV commercials, more billboards, more TikToks, more advertisements in kids' games. We want to make sure we are aware all the people are who are spreading this information on Spotify, so that we can counter misinformation that other people are putting on there. We want to make sure we're getting the right information to people so they can make an informed choice. It's still about making a choice, but we want it to be an informed one.
You know, you bring up kids there, and a lot of the places where they could put more ads on, like social media, TikTok, as you said. The FDA could authorize Pfizer's vaccine for kids as young as 6 months old, and that could happen pretty soon. Just 16.7% of kids ages 5 to 11 in Indiana are vaccinated right now. So do you think it's worth opening up the vaccine to more children?
Well, here's the thing. It's not going to change because of the reasons you mentioned. Our population level of protection much. Less than 20% of kids 5 to 11 are vaccinated. I don't expect you're going to get higher than that for under 5 years old. What it will do is give some of those parents out there who are scared, who are worried, who want to travel, who have older kids in their house going in and out of school, the ability to protect themselves. And psychologically, and again, this could be construed as a good thing or a bad thing, but psychologically, it's going to give public health officials and other people more confidence to be able to reopen with the knowledge that, hey, if you want to protect yourself, there's a vaccine available out there for you to protect yourself and your child. And so we don't need massive mitigation measures in many people's minds moving forward once we get to that place where everyone can protect themselves with a vaccine.
Well, we certainly want everyone to be protected, Dr. Adams, and we know that COVID has been around for more than 2 years now. Is this virus heading toward becoming an endemic pretty soon?
Well, I want people to understand endemic is a epidemiological, a scientific definition, and it means the disease has leveled off at a steady state in the population. We aren't there yet. Remember, just as long as it takes to get up the mountain, it takes that long to come back down. So cases are dropping, but we're still at a high rate of spread and death. We are not in an endemic state quite yet. We still got a ways to go. But the good news is, I think later this spring, early this summer, we have the tools and we have the ability to be in a good spot if we can continue to promote vaccinations and boosters, and if people continue to do their part now to keep from overwhelming hospitals. So good news coming. We're not going to be at an endemic state anytime soon, but we will be in a place where we can live with the virus and get to our new normal.
Well, it's nice to know that we've got some hope on the horizon. Thank you so much for joining us, Dr. Adams. Definitely stay warm out there.
Thank you. Take care.